Hi, fearless friends. It's Amy Schmidt, and welcome to this episode of the Fearlessly Facing 50 and Beyond podcast, which is now transitioning to the right size life. So excited about that. I'm Amy Schmidt. I am an author, a podcast host, a TEDx speaker, and a media expert all around reinvention and confidence for women, especially at the later stages of life, over 50. I used to call it midlife, but we're beyond midlife at that point. Unless we're going to be living to 120, and who knows? With the way science is going, we don't know. But I will say I'm real excited to be bringing you this series. And we're going to be talking about topics that are really, really important. When we talk about the right size life, we are talking about aligning our space physically, mentally, emotionally to the stage that we are in right now. Small daily habits that we can incorporate into our life, into our physical spaces, into our homes, into our mental and emotional spaces as well. And so that we can continue becoming who we are in this next chapter. Today, we're going to be digging into the topic of sleep apnea. Now, this is really important because as we get older, there is a high percentage of women who struggle and suffer with sleep apnea, and they don't even know it. The statistics are actually staggering. And this is a personal topic for me because I had a sleep study done a while back. My primary care physician said, you know what, Amy, let's go ahead and get that done. You said you're having some sleepless nights. And a lot of times we just attribute that to, menopause, to hot flashes, to waking up in the middle of the night. We're supposed to be feeling this way. We're supposed to be feeling tired. This phase of life. But actually, that is not the case. I actually had a sleep study done and it showed that I had mild sleep apnea. The more concerning part for me of that study was the fact that my oxygen level was dipping below 80% at certain times during the night, which is very significant for brain health, for cardiovascular health, for all of that. So this was really important for me to further the discussion around sleep apnea and how can I resolve and be healthy around this and get something that will help with this problem. It was a really big deal. And I have to be honest with you, I put it off. I put it off forever because I said, I'll lose some weight or, I don't have sleep apnea. I'm sure it's something else. So with that, I want to introduce my guest today, who is my personal physician, Dr. Cannon. He actually, I can read his bio real quickly here because he has a substantial background in dentistry. So he's been practicing general dentistry for over 25 years. He received his BS in biology and animal sciences from the University of Florida, as well as his dental degree from the University of Florida College of Dentistry. His postgraduate training is from the University of North Carolina, Chapel Hill School of Dentistry, and he's a member of the American Academy of Dental Sleep Medicine. So I am so excited to introduce you today to Dr. Cannon, and we're going to be talking all the things about sleep apnea. So you don't want to miss this episode, so stay tuned. Thanks, everybody, for joining us today. As you heard in the intro, this is a really important topic. And you know what? I'm going to start actually, before we even dig in with Dr. Cannon, here's a couple of statistics that I think are pretty shocking. Up to 90% of women with OSA are undiagnosed, often because they do not present with the classic loud snoring. And then the Society for Women's Health Research, nearly 1 in 5 women have sleep apnea, a disorder that affects daytime functioning, but about 9 in 10 women with sleep apnea don't know they have it. Wow. Okay, so those are some big statistics to start. And yes. Dr. Cannon, welcome to the show. I'm happy to have you here. I know this is round 2 because we did an Instagram Live. And our recording, what happens? We get some technical difficulties, but I had so many reach outs after it saying, hey, when are you going to post that? So we're going to go ahead and do this as a podcast episode. So it'll be audio as well as video. Dr. Cannon's got a few things to show us, but tune in and make sure you share this with the women in your life, whether it's a friend, a colleague, your mother, a sister, whatever, because this is an important topic to dig into. So Dr. Cannon, welcome.
Thank you. Thank you for having me, Amy. I'm glad to be here.
Yeah, absolutely. I think this is something that it's funny. I know there's recency bias or whatever it is, that term where all of a sudden you start talking about sleep apnea and it's showing up everywhere. Mm-hmm. And that's definitely been happening for me. Sure. I wanted to share real quickly, I did a little bit in the intro, but my story behind this was the fact that, I went into my primary care doctor. They said, let's do a sleep study. I got one. It showed, wow, you have some sleep apnea. You're stopping breathing sometimes during the night. And what did I do? Like most women do, they put it off. They push it to
Mhm.
the back burner and they say, "Nah, it can't be right. That can't be me. I'm going to lose the 10 pounds I need to lose. This is not happening. I'm just going to put it off and not worry about it."
Sure.
Well, luckily, after I put it off for quite some time, I got in touch with Dr. Cannon, and he has really changed my journey around this, my trajectory of just sleep apnea and being able to sleep at night,
Mhm.
to breathe and have the right oxygen levels, being recorded now. I mean, it is a big difference. So that's a little of my journey. But Dr. Cannon, let's dig into this with women.
Sure.
How many women come into you compared to men?
About 50-50, maybe
Really?
60-40 men to women, probably
Okay.
a slight edge to men, but a significant number of women. And men and women present very differently with sleep apnea.
Let's talk about that.
Men are kind of the characteristic, big guy, big neck, big tongue, lays there not breathing for a minute and a half, snores, epic snoring that can be heard throughout the house, that kind of thing. That's characteristic of men. Women tend to be much quieter. It's a much more insidious kind of issue to have. Women tend to not snore very loud, and they will fight very hard to keep their airway open. Sleep apnea occurs when your tongue relaxes when you go into REM sleep. So your tongue relaxes and falls back into your airway. Well, your tongue is attached to your lower jaw. So if you can bring the lower jaw forward and jut it forward, then that's going to pull the tongue forward and keep the airway open. Many women, some men, but mostly women, will do that during the night. They will keep their jaw protruded forward to pull their tongue out of their airway. They think it's a protective reflex. It's men, again, men do it, but it's much more common in women. They think maybe it's a maternal instinct to fight to keep your airway open,
Really?
but you'll fight to keep that tongue out of the airway, but you're doing it, you're using the muscles in front of the ears, in the temples, and then often down the back of the head and neck to keep your airway open. So women have much better numbers. They're not as severe with their apnea, but they're fighting all night and they're waking up with headaches and migraines and TMJ conditions and things like that. Yeah.
That's so interesting because one of the questions I had submitted was from a woman who said, I wake up with a slight headache.
Mhm.
Could that be sleep apnea? So right there, that could be
Sure.
something. And grinding our teeth.
Yes.
Let's talk about the anatomy of the mouth because I
Yeah.
find this fascinating, and it must change over time because more postmenopausal or menopausal women tend to have sleep apnea.
Yes.
Is the tongue a muscle?
Yes. In
It
fact, I've
is.
got a little picture I can use.
Awesome.
I'll try to keep the glare off it. This is a like kind of an anatomical photo, and I use it during our consults to really to illustrate how large the tongue is. We often think, kind of stick your tongue out. That's about that much of the tongue. What blocks the airway is not the tip of the tongue, it's this back of the tongue. It's this vertical part of the tongue that falls back into the airway because, again, the tongue is a muscle. So every time you go into REM sleep, which is that layer of sleep we need to feel rested in the morning, every time you go into REM, everything becomes relaxed almost to the point of paralysis, including our tongue, and that just falls back into the airway because of gravity, and it blocks your airway. So yeah, it's that simple. I really try to tell people you're not doing anything wrong.
Right.
There's nothing physically wrong with you. It's just that your tongue relaxes and falls back in your airway. The number of problems that it causes are numerous, but it really is that simple of just your tongue and your airway.
Well, for the women listening and watching, women want to solve things. All right. We want to solve things. We want to say,
Mm.
we can fix this. Like,
Mhm.
I don't want to wear something every night. I don't. So I'm going to exercise my tongue. I mean, I'm going to do something to change this. Is that
Mhm.
possible? Is there a genetic link here? Is this just the way as we age, our tongue muscle changes?
Mhm. It's genetic in the sense that, we're all a product of mom and dad. So if dad was a big guy, had a big tongue, mom was on the smaller side, had maybe a recessed jaw, what it creates is a situation where there's just not enough room in the mouth for the tongue. And it's going to tend to fall back into the airway and crowd the airway. When you're awake right now, your tongue is forward, your tongue is flexed again because it's a muscle. It's when you go into REM and everything relaxes and you sort of lose control of your tongue and it just falls back into your airway and closes it. So there are some genetic in that sense. It does get worse over time. The muscles get weaker, they get looser. The tissues around the throat will also contribute to this. the uvula, the little punchy bag thing back there. I mean, those types of tissues will fall back in the airway and contribute to the problem. And that does tend to get worse as we get older. Yes.
Interesting. I talk a lot about purpose and passion and kind of how they intersect. Now, I know the
Mm,
story from Dr. Cannon personally, but would you just share briefly, really why you're so passionate about this and
sure.
what triggered this for you in your life?
Yeah. So I've been a general dentist for about 26 years. I graduated the University of Florida. My daughter's there now as an undergrad. I'm so proud of her.
Love it.
Um, I about 14 years ago started taking classes about sleep apnea. And part of the original course that I took, it was a 3-day course. It was up in Orlando in a hotel, and they give you a sleep test kit to take up to the room to use the first night. And then by Saturday of the course, you get your results. Well, mine, I stopped about 14, almost 15 times an hour, and my
Stopping
oxygen got
breathing.
down to stop the
Stopping
breathing.
breathing.
Yeah. So
Wow.
on average, about every 3 or 4 minutes, I stopped breathing, and my oxygen got down to 79%. And that scared me. I've been in medicine my whole adult life. I worked in the hospital for years. I mean, if you've got the little pulse oximeter on your finger and it gets down to the low 90s, I mean, they're coming in to check on you because
Right.
something's wrong. And I'm down at 79%. I see that all the time on people's sleep studies. I mean, they're in the 70% range, and we scratch our head and think, how are people living with this?
Yeah.
It just doesn't make sense.
Not to interrupt you there,
Um,
but that's oxygen deprivation to the brain and to the
exactly.
cardiovascular system, right? Okay.
It
Just for
really is.
our listeners. Okay.
It does. It deprives the brain of oxygen, which is going to suffer predominantly, and then also the heart, because the heart is then contributing by beating faster, by beating harder to compensate for that low oxygen. So I made myself, once I got those results, I made myself a dental device. I was my own first patient.
You made
And it changed my life. I mean, overnight. I hate the word literally, but it literally changed my life overnight because I went from waking up frequently during the night, having really bad anxiety, depression, having very high blood pressure that wasn't coming down with medication. Really that gastric reflux. I would get stomach acid coming up while I would sleep. Those went away almost overnight. And
Wow.
I decided, wow, this is something I really want to include in my repertoire of things I do in general dentistry. But the more I started doing it and the more I realized how much I could help people sleep better, I could help couples sleep together again because now they're both sleeping quietly. I decided
Yeah.
this is what I want to do and open my own practice. What really got me though was what happened when I was a kid, and my father had a fatal heart attack when I was 6. He was 38 and in his sleep. And when I took that first course, one of the topics of the medical conditions that happen as a result of sleep apnea was sudden heart attack in the middle of the night. I thought, wow, that's what happened to my dad. So I called my mom that night and I asked her about dad and if he had sleep apnea. And of course, her response was, "What is that?" So
Right.
I mean,
Yeah. What
she
is
didn't
that?
even know what it was. And that's the
Right.
problem, is nobody really knew what it was. But when I explained it to her, she was almost in tears and saying, I think that's what happened to your dad. I mean, he would snore, he would stop breathing. I'd have to kick him in the back to get him breathing all night. And I really think
So
it
relatable to
caused
so
his
many.
heart to redline, and he just never woke up. His heart just redlined into nothing. So
Wow. Yeah,
yeah,
well, I'm so sorry about that because
thank
that's a
you.
devastating story. But at the same time, it's, so glad that there must be a genetic link there. I
Hmm.
mean, there has
Hmm.
to be. Yeah. I
Yeah,
mean, I guess it's genetics and how your mouth is, set up and all of that. But
sure.
thank you for sharing that because that
Yeah,
that shows why you're so passionate about it. And when I went in to see Dr. Cannon, you can tell his passion. I mean, he looks at each patient differently. Now he has a dental device at Sleep Better Sarasota. So let's walk through that a little bit,
hmm,
especially for people that are watching because they're watching all over the country and the world now. So when they're listening to this, let's walk through that device and how it works because people have heard of CPAP.
right.
People have heard of that. Some people might have heard of Inspire, which I know
Hmm.
is a little bit more of an invasive type
Hmm.
device now. And
Right,
you'll have to talk to me about if there's medicines or something coming out for this because more and more people are talking about it. But let's talk
right.
specifically about this device because it has
Sure.
certainly helped me.
Yeah, absolutely. Yes, the CPAP is just really an air compressor with a mask. It's going to blow air up your nose, your mouth, sort of inflate your airway. I never have anything bad to say about it, but I hear so many comments from so many patients that just cannot tolerate wearing the mask on their face.
Right.
Probably 4 out of 5 people that I make a dental device for have tried CPAP and just can't tolerate it. So if you've tried it and you're frustrated with it, you're not alone out there by any means. The Inspire is a little device that's inserted. Then there's a
Right.
wire that goes from that through your neck and into your tongue, and it'll stimulate your tongue to flex and open up your airway. It is effective, but it's a pretty major surgery. You don't want to be doing
Wow.
surgery in the neck if you don't have to. It's a
Wow.
dangerous place to do surgery. So
So it sparks your tongue. Wow.
yeah,
All
yeah.
the tongue. I mean, who knew this tongue was so involved in sleep
It,
apnea?
it really is. It's all about our tongue. So the dental device works on the premise that we have our upper and our lower teeth. And what's happening, and again, our tongue is attached in there to our lower jaw. So it's going to attach along the inside of the floor of your mouth. And everything's just falling backwards and your airway's collapsing and you're suffocating. Then it fires forward and you start breathing again. And then it falls backward and you start suffocating and breathing. That's what grinding of our teeth are. A lot of people come in and say, oh, my dentist told me I grind my teeth. I
Right.
made night guards for 20 years. The problem with just a night guard is if we just have that on the upper teeth, your jaw is still going to fall backwards. There's nothing that's going to keep it from falling backwards into your airway. It's going to protect the surfaces of your teeth, but you're not going to keep the jaw from falling backwards and the tongue from falling in the airway. What we need is a second piece that's going to interact with the top piece. And they're always tough to see, but you have your
Right.
upper and you have your lower, and we call this one a dorsal because it looks like a dorsal fin. And
It
everyone always
does.
thinks, "Oh my gosh, how am I going to wear that with those big
I
fins?"
wear it.
You
Yep.
you wear it, and you would never just wear the lower. You're going to wear them as a pair,
Yeah.
and when you have them both in, your cheek's just going to sit right over the top of that. But if what happens is it creates a gating effect where you're only going to fall back to that position. You can still open and close, you can still wiggle around, but you're only going to fall back to that position because that fin and that block interact and make a stop so you don't fall back any further. They
Yeah.
are adjustable. So we do the fitting and then you come in about every 2 weeks and then we move the little block forward and then that brings your jaw a little bit further forward. We don't want to start too far forward because that
Right.
can stretch some jaw muscles. It can trigger off some TMJ conditions. But if we set the jaw at the right position and move at the correct pace, bring your jaw very slowly forward over the course of a few weeks, we can actually correct TMJ problems because no longer are you going to be posturing your jaw forward. Your jaw is already going to be there. Your airway
Right.
is going to be open. So your muscles will just shut off and relax because they're no longer trying to keep you breathing. Your airway's staying open because you're wearing the dental device.
For those that are watching, you will have seen that, and I'm going to share a photo too of me with it because I put it in every night. And I have to tell you, well, I'm a very compliant, rule following girl, so I have been wearing it every night, and I didn't have any problems. I know some
Mhm.
people have had problems with a little jaw soreness, but
Mhm.
Dr. Cannon goes over some exercises you can do in the
Mhm.
morning. I will tell you from the first time we recorded to now. I've had like none of the real jaw pain that I was having.
Mhm.
Sometimes I'd wake
Mhm.
up with an achy jaw before the device, and that was
Mhm.
probably sleep apnea as
Yeah.
well.
Yeah. You're using
Which,
those muscles right there to posture your jaw forward. If you've ever taken a CPR course, they would say two things to open up the airway. One, you lift the chin.
right,
So that's going to be the muscles in front of the ears, the temples that are going to be posturing the jaw forward to pull the tongue out of the airway. And then also tip the head back. So a lot of people, especially women, will sleep with their head looking up and back, and they're putting a lot of pressure on the muscles in the back of the head and neck. I mean, I have people tell me all the time, I have neck problems. I go to the chiropractor. A lot of that is because of what you're doing with your skull to try to get your tongue out of your airway, but you're feeling it in the neck and shoulders because of it.
wow. Do you
Yeah.
have a testimonial besides mine? That is, I mean, I've had great results, but can you just share a story? I mean, I don't think there's any, to share names or anything, but just a story of somebody that's come in and I mean, they've just been so thankful that, they had the sleep study done and now they have this
Mhm.
device and their life has changed.
There's actually a couple that I've treated, both the husband and the wife.
Hmm.
They could not sleep in the same bed together
Yeah, sleep divorce is
because
real. Yeah.
he was snoring so badly. So he's sleeping in a separate bedroom. So sleep divorce exactly is a very real and common thing, and we see, and that can lead to a lot of marital strife if people can't sleep in different beds. They have a one bedroom apartment or something like that. It creates a lot of marital strife. It
Yeah.
creates a lot of anger amongst partners. You're laying there first of all, you're laying there scared. You're laying there scared that this person's not going to take another breath again. So that keeps you awake, but you're
Right.
angry at that person for keeping you awake all night, and it ends up spilling into the morning, and you got fights in the morning, and a lot of it's because of the sleep apnea. So he was sleeping in a different room. Um, She was having migraines when she wakes up, and a lot of jaw muscle soreness and pain. I think she was also having gastric reflux, like I
Wow.
was.
Yeah.
We treated him, and he loved it and was just did so much better. They were able to sleep in the same bed together again. Well, it got her thinking that maybe she was having some of the same problems. So a few months later, we treated her and got rid of the headaches, got rid of the jaw soreness. Still had a little bit of gastric reflux, which we were trying to kind of work around. She was still going to take some medication because we couldn't really fully get rid of that. Um, but just a couple that we were able to bring back together, and both of them felt better, and they were also able to sleep together again, which was
Wow.
wonderful. So,
Isn't
and
that
that's why I love
awesome?
doing it. I
Yeah,
love doing it.
you see results. Just for those of you that are just tuning in, I have Dr. Cannon with me from Sleep Better Sarasota. We're talking about sleep apnea, and I'm going to share that up to those statistics I shared at the beginning. If you're just tuning in, Society for Women's Health Research said nearly 1 in 5 women have sleep apnea, a disorder that affects daytime functioning for sure. You know, all of a
Mm,
sudden that midday you're getting tired,
sure.
but about 9 in 10 women with sleep apnea don't know they have it. So let's transition to the sleep test. Now, I had
Mhm.
a different sleep test done in a different part of the country where I first kind of, if you were listening at the beginning, I was diagnosed and I put it off because I said,
Mhm.
there's no way I have sleep apnea. It's embarrassing. There's no way. So I'm just going to forget about that. Now, the sleep test I did with you was really interesting. Can you show that? I think you have it for
Yes.
those that are
Yes.
watching.
So it's almost like an Apple Watch. It's a little
Yeah.
wider, but it just sits right on the top of your wrist. And then there's also a finger sensor. It plugs in, but it would go on your finger like this. So I'm
So
trying to get the
easy.
whole thing in
Yeah.
view, but basically, I mean,
Plugs
that's it
in.
from there to there.
And it
That
goes
that's the sleep
to
study.
our phones, and we can have an Android or an Apple, right? Yeah.
Hmm. Hmm.
Okay. Okay.
Yes. Pair that up. You wear it for 2 nights. Very simple test to do. They are very accurate. We get that sometimes. People have a little trepidation. Like, are these accurate? What
Yeah.
they did is they would strap these to people while they were also doing a full in-lab test. So they go in and you're wired from head to toe and everything, and
Right.
you're also wearing this, and the numbers were jiving. And so the technology has really come a long way to where you can wear a watch. Some of them are even a ring on your thumb that you wear, and we do get accurate data. The problem, we're always going to get more data at a sleep lab. You're going to get brain waves. You're going to get how the person is sleeping, whether they're on their back or their side, which is important, but it's not necessarily critical to know if someone stops breathing. We don't
Hmm.
need brain waves. We don't need to know if they're sleeping on their back. I just need to know if their airway's closing and how many times per hour does that happen,
Right.
to make a diagnosis. So
And your test, I did it 2 nights.
yes,
Okay. So two
yeah,
nights. So
did.
you commit to 2 nights. They don't have to be right
Mhm.
in a row, but they should be within a couple days of each other,
Usually,
right?
yeah, yeah. You
Okay.
can do
And
it
then you,
over. We have a way to do it over the weekend where you could do it like Friday and Saturday, and then if for some reason it didn't get enough data or something, you could always do it Sunday night as well. So yeah, but sleep testing has become very easy. It really is a barrier to people getting treated because they think I have to go to a sleep lab, and you don't have to go to a sleep lab. Most sleep doctors send people home with a home sleep test kit now. It really has become the norm. And
yeah,
then only if there's really weird data, there's something called central sleep apnea or some other conditions that happen that people sleep poorly, then maybe go to a sleep lab and look at brain waves and that kind of thing. It's always better that way, but it's not necessary. And
yeah.
it creates an unnecessary barrier to people getting treated because they don't want to go to a sleep lab. So,
Interesting. I thought it was very easy. I had
mhm.
to hush my husband a couple times when I put it on because I'm like, Shh, I'm really supposed to be sleeping now. You know, you have a little anxiety at first because you're
Right.
like, oh boy, it's
Right.
monitoring me.
Yeah.
But you know, for all those women out there listening or watching right now that haven't taken a girls' trip because they're like, I don't want to share a room. I'm kind of snoring, or they don't want to because everybody, I mean, I'm telling you, the statistics are huge on this, and there has
Yeah.
not been enough talk about it. I mean, we talk so much about heart disease for women. We talk so much about menopause, but we talk about these things, and sleep apnea is a component of all of that.
Mhm. It really is.
So it's so important to get tested, to go talk to your doctor, or come. Well, I'm in here in Sarasota. Come see Dr. Cannon. He's the best of the best. You can find him. And how would people go about? Let's walk through just that scenario of a woman
Mhm.
saying, I don't know. I mean, do I really need to do this? It's going to be expensive. It's going to be invasive. And now it's going to be embarrassing. What would you say to
Mhm.
that woman listening right now?
Gosh, don't be embarrassed at all. It perplexes me why there is such a almost a stigma about it. I mean, people talk about ED and things like that more, which is can be
Right.
a absolutely be affected by sleep apnea, by the way. But they'll
Really?
talk about that more than they will with sleep apnea. Like there's something you're doing wrong or you're embarrassed about. And like I said, it's just your tongue falling into your airway. That's all that's happening. You're not doing anything wrong. There's nothing physically wrong with you. You're just suffocating on your own tongue. And to
Wow.
get a
That is
sleep
so
study is just
wild.
going to, yeah.
That's so
And a
wild.
sleep study is very non-invasive. It's going to show how many times that happens per hour. That'll give us an idea of the severity of it. And then we can talk about what option is going to be best. I mean, for 80-90% of cases of sleep apnea, a dental device is a very extremely effective therapy for sleep
Yeah.
apnea.
Yeah.
So,
So for my actual, let's see, we've got about 6 minutes left. For my, sleep study, the first one that came back and it was that oxygen level that was dipping,
mhm,
like 79. It was low. And
yeah.
I had really no realization of that. My husband was saying things like, you're not necessarily snoring. Some nights I would, but most of the time he just thought I was sleeping differently. That's what he
Mhm,
would say.
mhm,
Your
mhm,
sleep pattern seems different. And of course, I
right,
just blame that on hot flashes and everything else that, you're experiencing as a woman at this stage of
right.
life. But indeed, it was sleep apnea. I had my test repeated. Dr. Cannon went in and adjusted it a bit for me. And
Mhm,
I will share that I have huge dental phobia. I have issues with my teeth since I was little, since I got my braces off. So I have huge phobia around going
mhm,
to any dentist. And this was the easiest procedure because even to get the dental device, they didn't do a mold like they used to in the
mhm.
old days where I would just for fear my teeth would come out. It's all this I know it is funny, but I
Oh, I've heard
actually
that
had
before.
dreams
Yeah,
of like my teeth being on my
yeah,
pillow because I was so
yeah.
scared these would fall out because I have a dental device, not device, but bridge crown.
Bridge.
Um, anyway, the actual how you did it was so interesting. Can you just
Mhm.
kind of describe what you do? Because the innovation around this is mind-boggling.
Yeah, it's they've actually been around quite a while, and I'm it always surprises me. People say, "Oh, my dentist used that." So a lot of dentists are starting to use the digital scanner. Um, it essentially is a digital camera. There's no radiation. A lot of people ask me, "Is this X-rays?" No, it's just a digital camera, but it's like a wand, and we basically just walk it around the mouth. It takes
Doesn't
thousands of
hurt.
pictures of the teeth. Doesn't hurt a bit. It's much less invasive than the tray full of goopy stuff, which I did. I've done 10,000 impressions in my career, and I've been on the other end of all those and
Yeah.
know that it's not fun. I have tried to coax people through impressions my whole career. Like, okay, cross your feet. Okay, uncross your feet. Like, just tip your head forward. I
Oh,
mean, so it's.
yeah.
I know nobody likes that. But the scanner is much less invasive. It's much easier. It doesn't gag people.
No.
Uh, it gets a much more accurate impression because it doesn't distort, and it also goes to the lab much faster because I don't have to stick an impression in the mailbox and have 4 or 5 days out to St. Louis to the lab that we use. So
Right.
it's much faster, it's much more accurate, and it's much more tolerable by patients. So I think you'll really like it.
Yeah, I mean, it was just easy to go in and have that done. Then when I actually got the device, Dr. Cannon fit me, and then I was so nervous. I mean, you can probably remember. I was so nervous. I was almost in
Yeah.
tears because I thought, oh my gosh, if I pull this out and my teeth come out, I'm, and that's what my husband was worried about
Hmm.
for me too, to be honest. But
Hmm.
you were so cool, calm, and collected, and just said, "All right, Amy, let's try this." And he actually then positions, or however you manipulate
Hmm.
the device so it fits you
Hmm.
properly. So this
Right.
isn't something like you just mail order and you're seeing something on
Right.
TikTok and you're getting it and you're putting it in. It is nothing like that. This is custom tailored to you, and I
Right.
just think it's amazing.
And that is becoming more popular where there are companies that are you do your own it's DIY dental device therapy. I mean,
Wow.
I, I don't get it. I like the fact that more people around the country and around the world can get treated, but you're doing it. You're making your own impression. They send you something. You fit it yourself. If it doesn't fit, what do you do then? You know, I
Exactly.
don't I don't routinely see people that come in that had something made online. I wouldn't want to mess with any. So who's going to follow up when your mail order device doesn't work?
Right.
What we do is custom fitted. It's
Yeah.
an amazing device. They're so comfortable. What made it so comfortable for you, Amy, was they're hard acrylic, but on the
Yeah.
inside of them, I don't have it on the sample model, but on the inside is a very thin, soft material. It's called a thermoplastic liner, and it just creates a little bit of a cushion, and it's why we were able to get it to fit so well but
Right.
not where it's so tight on any of those crowns or bridges that you have.
Yeah, it's
So,
been
and it just
amazing.
makes it so much more comfortable that way.
Been amazing. I mean, it's
Yeah.
been an adjustment, but it's been amazing. Let's talk quickly. I did have a question come in about hygiene. People
Hmm.
are very worried about the bacteria in your mouth.
Hmm.
How are we
Sure.
cleaning it? All of that. So let's walk
Yeah.
through that if you get a dental device.
Sure. Cleaning it very, very simple. We use a toothbrush and some toothpaste. Toothpaste is bacteriostatic. Um, you would basically just brush in all the little tooth spaces. There's a little gap on the side where we do the adjustments that you want to keep clean. We go over all this with everyone of how to do it. But basically, you're just going to clean in all the little tooth spaces on the flat side. You can use some people will get like a little ultrasonic cleaner. You can get them on Amazon for like $40. Put
Yeah.
some water in it, dunk them in there. That kills bacteria, the ultrasonic waves. You can put them in some peroxide for a few minutes just to kind of freshen them up. But they're very easy to keep clean and very easy to take care of.
Oh,
Obviously,
that's good
stay on
to know.
top of your dental cleanings and things like
Yep.
that, so the mouth is clean. And then it's
Right.
just a matter of daily cleaning of the device. Honestly, it probably takes 3 or 4 minutes to clean it, though, compared to CPAP, which can take. I mean, you've got to run it through a whole, it's not sterilizer, a disinfector,
Right.
for 30 minutes and that kind of thing. So much easier to take care of than CPAP.
And hopefully people are doing that because that is an important
Yes.
step with that.
Yes.
Um, Thanks so much. I mean, I just think it's so great. I am a fan of Dr. Cannon. I wish for everybody that's in and around this area to go see him. We'll be sharing all of his contact information. But,
Mhm.
for those of you that are watching in other parts of the country, how should they get this journey started about how to
Sure.
really treat sleep apnea? Find out if they
Right.
have.
For us, if someone's local, they can check us out at Sleep Better Sarasota, as you're going to provide. We do complimentary consultations over the phone, or we can have someone come in. And it's just like this. We just talk about what sleep apnea is, talk about what a dental device is, and there's no pressure or anything. Um, for people that are around the country, I am not a member of the American Academy of Dental Sleep Medicine. I was for a while. But there is a website you can go to for the American Academy of Dental Sleep Medicine. It is AADSM dot, I believe it's .org,
Okay.
AADSM.org. You can put in your zip code and it will tell you where a dentist is in your area that does dental sleep medicine. Like I said, not every dentist that does dental sleep medicine is part of that academy, but
Right.
it is a good search engine to find someone close to you.
Okay, appreciate that very much.
Yeah,
Yeah, Dr.
absolutely.
Cannon, I actually called and I think, like I said before, I think I hung up on you. And because I was so nervous about it, and I'm like, I don't have sleep apnea. I'm just going to put it off another 6 months, which would be so
Right.
silly because it's been a life and game changer for me. I have more energy. I never knew what it was like to sleep really well.
That's it. When you said earlier in your opening statement about women don't even realize they have it, I find men know they have it. They're told they have it. They're pestered by their bed partner that they have it. Women, you're too busy to be tired. You got too much to do to be
Oh,
tired. But
I
yet
love
at
that.
5 p.m. in the afternoon, you're just falling asleep and
Yeah.
you've just run out of steam. You're waking up with migraines. I mean, things like that. That is all your airway closing, and there's a solution for it.
It's amazing. Yep, yep. So please submit your questions because we'll circle back to Dr.
Yeah.
Cannon and let's get him out there talking about this more in other parts of the country because you're so great about it and so knowledgeable and so
Thank
caring.
you.
And you don't always find that. And
Yeah.
I really appreciate that a lot. So get tested, ladies. We can figure this out and don't have it be the stigma and
Mhm.
embarrassing and try
Yeah.
to lose the 10 pounds. I mean, certainly if you need to lose 10 pounds, lose 10 pounds. But in addition to that, well, let's end with that part because I know a lot of people think it's a weight issue, and there
Mhm.
is a component of that. But let's just talk about that briefly because we still have just another minute.
I'm really glad that came up before we finished because it's very easy to understand that being overweight contributes to sleep apnea. Our tongue gets bigger, our neck gets bigger. That's obvious.
Our nose gets
What's
bigger.
was that
Our nose gets bigger
Our
too.
nose does get bigger. Yeah, yeah. And the tissues
Oh,
inside the nose get thicker and
yeah,
bulkier. But
crazy.
what's missed often is it's the sleep apnea that's creating the weight gain. When your body is suffocating, when your airway is closing and you're suffocating, your body goes into fight or flight mode and it uses the hormones adrenaline and cortisol. And cortisol will wreck our efforts to keep a healthy blood sugar. So that can really affect and create diabetes, type 2 diabetes, but it also makes it very difficult to maintain a healthy weight when your cortisol levels are fluctuating like they are. So by getting the airway open, get your stress hormones under control. Now your body's going to be more physiologically in a state to lose weight. You still have to walk, you still have to eat right. You can do GLPs, and those are going to work so much better. The injectables You asked earlier if there are medications for sleep apnea. They market that these will help sleep apnea by losing weight, but you've got to get the tongue out of the airway to really effectively treat sleep apnea. So,
Oh, fantastic. I love to end on that. Thank you so much. Thanks for all the wisdom today. Go to Sleep Better Sarasota. I will share all of that information. Dr. Cannon, keep in touch because, well, I'll be in to see you anyway, because I'm sure I'll have
yeah.
to have it checked at some point. But I'm thankful for you. And I just appreciate you sharing all your wisdom.
Thank you, Amy. It's been a pleasure to be here and an honor to speak to your audience.
We'll see you soon.
Okay, thanks.